Morning students. Today we will see about the blood supply of the heart. So the blood supply of the heart is broadly classified into arterial supply and the venous supply. The arterial supply is supplying the oxygenated blood to the muscles and the walls and everywhere in the heart. So that is the one will be helpful to all the tissues or the cells in the heart muscles. We will see in this detail. The venous supply is nothing but the deoxygenated is collected from what are all the veins. So what are all the veins? We are collecting the deoxygenated blood, and these deoxygenated bloods are again drained into the right atrium. So in this chapter, first we will see about, if it may come as a 5-mark question. So in the atrial supply, the blood supply of the heart, first is the atrial supply. Atrial supply mainly started with the right coronary artery. So the right coronary artery, where it is started? It is starting from the anterior aortic sinus. It is starting from, what is the aortic sinus? Where the great vessel entering, in that point which is called the aortic sinus. Anterior is the front side of the heart. So right coronary artery, one thing you have to remember is, right coronary artery mostly supplying the conductive system of the heart. You know the conductive system, mainly SA node, AV node. SA node, AV node, where it is present? In the right side of the heart, right? So mostly in the SA node it is starting. So it's right side. So after this anterior aortic sinus, then it is going to the coronary sulcus. What is called this sulcus? Sulcus is between the right atrium and the right ventricle. There is a groove there where it is supplying, and this artery, it's just descend down to the posterior to the interventricular groove. So this is about the right coronary artery. So first we are seeing about the blood supply, arterial supply of the heart. Arterial supply will be right coronary artery and the left coronary artery. Right coronary artery originated from the anterior aortic sinus. I will show you the picture later. And then it is going to the coronary sulcus. Sulcus, it's like a groove between the right atrium and the right ventricle. And then it descend down and to the posterior interventricular groove it is going to the posterior side. Then if you see the left coronary artery, the left coronary artery, main thing you have to remember is, major part of the myocardium it is supplying. Understand? Right coronary artery mainly supplying for the conductive system of the heart, but the left coronary artery mainly supplying the major part of the myocardium. Then it is to the, where it is originated? When you draw the heart this side, in the back side of the heart. So the posterior, where the right coronary artery starting, it is starting from the anterior aortic sinus. So but left coronary artery from the left posterior aortic sinus. Right anterior aortic sinus, this is the left posterior aortic sinus. Then also it is from that left posterior aortic sinus, it descend to the coronary sulcus. Coronary sulcus, if you turn back the heart, it is the behind the pulmonary trunk which is going from the here. So which is behind, it is supplying this area, and it is divided into two arteries. What is that? Anterior interventricular artery and circumflex artery. Okay, anterior interventricular artery and circumflex branch of the artery. Then from the circumflex artery, the posterior part of the coronary sulcus between the atrium and the left ventricle. So it is this. In some places these arteries are getting anastomosis with each other. Okay, not unlike the this one like a circle of Willis, but few arteries are getting anastomosis. Okay, now we will see this picture. So this is the anterior side of the heart. So you can easily draw the rough diagram. This major vessels you can draw, and you just no need to mark all these things one. First you can write about the where the anterior sinus. Okay, this is the anterior sinus. So as we told in the theory, from the anterior sinus, which is the artery coming down, so it is called the right coronary artery. It is going to the coronary sulcus, right? And then and then this is of the left posterior sinus. It is in the pulmonary trunk, the posterior, the dotted area shows that when you turn back the heart in the other side. So in a hypothetically we are showing this line. So this is called the origin of the left coronary artery. So left coronary artery is going, and this is called circumflex artery. And this side you can, the margins, you can draw one line. It is called the right marginal artery. Then will be, this one is a circumflex artery. This side of this one is called left marginal artery. Then this is called the septal division of the artery, you can tell. Okay, then we are telling about posterior interventricular septum. The interventricular area which is supplying is called the posterior interventricular artery. So just you can mark few artery. If this is a SA node branch. SA node branch, SA node which artery will be Sabi? This is the right coronary artery branch supplying to the SA node. So right atrium. So we have told major right coronary artery, major thing mainly supplying to the right side of the heart, right? This only conductive system of the heart. So we are telling this one is called SA node. This one, left one will be the cardiac muscles. So the left side of the muscles which is covering. So the marginal, when it is coming to the marginal artery, marginal side you can write very well, it is a marginal artery. So you can mark only these arteries and you can get the whole mark. Next we will see about the venous supply. So once the oxygen is supplied by the arterial system, and of course there will be cells will be exchange will be taken place, isn't it? In the particular internal exchange there is a carbon dioxide. It has to be taken out. Always this will be taken out by the veins. So these venous supply mainly collecting. This called coronary sinus. Coronary sinus nothing but the collection of the veins forms together, it is formed the coronary sinus. This coronary sinus is called tributaries. Tributaries. Very simple, you can remember tributaries, 3 you can remember. So what these 3 together is called tributaries? Great cardiac vein, middle cardiac vein and small cardiac vein. So this is called the tributaries. And then another one is called the anterior cardiac vein. What is this anterior cardiac vein? It drains to the anterior part of the right ventricle and it is openly directly into the right atrium. So this is called the anterior cardiac vein. Understand? And then about the Bayesian veins. The Bayesian veins is nothing but there are very smaller veins are there. These veins are mainly opening directly into the chambers of heart. So what is that? Venous supply. Venous supply mainly we are talking about venous supply mainly taking away the deoxygenated blood, taking the deoxygenated blood from the muscles of the heart and all the sides of the muscles of the heart, and mainly they are all these, the Bayesian vein, all these all collecting and then goes to the tributaries and all these tributaries, the collection of the veins will be open into the coronary sinus. This coronary sinus open into the right atrium. Understand? So venous supply mainly the basic major thing by the coronary sinus. Coronary sinus is nothing but collection of the veins together form this one. It's called tributaries, great cardiac vein, middle cardiac vein and small cardiac vein. Then anterior cardiac vein mainly drains to the anterior part of the right ventricle and open directly into the right atrium also. The Bayesian veins is nothing but this is the small veins. These all the veins are directly open into the chambers of the heart. So if you look at this picture, you can simply draw easily some greater arteries you can put and you can start from here. Okay, so these are all the great cardiac vein. Okay, the middle line, first you draw this line. This is the great cardiac vein. Understand? Then you put one line. It is called the middle cardiac vein. And then put small, this one will be this one. This one another vein I told you. It is called anterior cardiac vein. anterior side. We have marked anterior sinus. So posterior, it's the anterior side of the heart. So you can mark from the left atria. This is called the anterior cardiac vein. Understand? These all together which is called the coronary sinus. So coronary sinus consists of great cardiac vein, middle cardiac vein, the Bayesian. The Bayesian like a small artery, all these opening into the chambers of the heart. Understand? So this is about this one. So not only this, so what will happen? These arteries and veins we are studying. So once you are studying, you have to remember about how we remember about where this right coronary artery supplying major, where right left coronary artery. Then like imaginary line, you understand the concept and just draw. When the other heart and all will be open way we are dry. But this blood supply to the heart, we are cut section of the heart we are not drawing here. We are drawing the closed, the whole heart we are drawing, because then only we can show how the muscles, all the muscles of the heart getting blood supply. So it is easy also, not a cut section always we are drawing for the circulation of the heart. But blood supply, just some greater vein you put it, just you put like this structure and may mark it like this. In the middle you can put it as a coronary sinus. Coronary sinus consists of greater cardiac vein, medial cardiac vein and smaller cardiac vein. So the smaller cardiac vein, and then this is coming from the anterior side of the heart, so it is anterior cardiac vein. Simply you can mark the card by drawing the two pictures and marking the parts, and you can take and write something, you can get the marks. Understand? So whenever we read something, you have to understand about what is the blood supply of the heart. You have to remember by the arterial supply and the vein supply. And applied anatomy, it is very, very important to understand. Any place in the arteries, this is a vein in the arteries, there is a insufficient blood supply due to any reasons. So insufficient blood supply, what will happen? That condition is called atherosclerosis. Sometimes they may ask the insufficient blood supply, like that blood supply to the muscles of the heart. They may ask, you can select what is atherosclerosis, or 2 mark it may come as a what is atherosclerosis. Then angina pectoris. Angina pectoris is nothing but pain produced due to ischemia of the myocardium. Myocardial muscles ischemia, where there is a, why the ischemia? Ischemia means what? Ischemia means the blood supply is poor to the tissues. So the tissues are in the stage of going to die. So that condition is called the ischemia. So poor blood supply. Poor blood supply may be due to many conditions, due to many problems, the obstructions, occlusions or anything will may cause this condition. Understand? So blood supply of the heart. So you can very well, you can try remember how the blood supply of the heart, mainly you can divide into arterial supply and venous supply. This is right side, right coronary artery and left coronary artery, where it is starting from the anterior aortic sinus, and this one will be the left posterior aortic sinus. Anterior, this one will be posterior. You have to remember about this is for the conductive system of the heart. Mainly it is supplying. Conductive system means always will be coming on the right side of the heart. This will be mainly by the left coronary arteries, mainly supplying the myocardium of the heart. Then this one, it is down to the anterior aortic sinus, then to the coronary sulcus. Sulcus is between the groove like a structure between the right atrium and right ventricle. Then again it is descend to the posterior to the ventricular groove it is passing. Isn't it? Then the major myocardium, left posterior arterial sinus, and then goes to the coronary sulcus. Coronary sulcus, see, posterior side means in the back side of the heart. Back side where the major vessels are going, the trunk is there. Pulmonary trunk is there. So this coronary sulcus divides into 2. So anterior interventricular artery, circumflex artery. Then will be descend to the posterior part of the coronary sulcus between the atrium and the ventricle. Understand? Then will be venous supply. Venous supply by the veins, mainly by the, these are the tributaries you have to remember. Tributary, coronary sinus means it's mainly you have to remember about tributaries. Great cardiac vein, middle cardiac vein and small cardiac. So you know first you can coronary sinus you can put and mark it. From this anterior cardiac vein, from the anterior side of the heart, you can draw one thing. Thebasian small veins you write. It is called Thebasian veins. It's directly open into the chambers of the heart. Understand? This is the blood supply of the heart. What is the nervous supply or something? Nervous supply, though we will see the conductive system of the heart. So nervous supply also there. So conductive system of the heart is only present. So nervous supply is not present. Yes, but nervous supply also it is controlling for the sympathetic as well as the parasympathetic nervous supply. What is sympathetic? For example, suddenly I am telling today is the exam. Your heartbeat is increasing, right? Sympathetic supply. But heart is also not only sympathetic parasympathetic nervous system. Heart has its own conduction, automaticity. This is the automatic generation of the cardiac impulses. That will be called the conductive system of the heart, right? So that conductive system of the heart in the next video I will explain you in detail. I hope you understood about the blood supply of the heart. So you will never going to confuse about what is the circulation of the heart. Blood circulation is different and blood supply is different. Okay? Thank you.